Thank you, Mr. Speaker. With your leave, I rise to make my contribution in support of the Appropriation 2019 Bill of 2018. And the contribution I will make will be in two parts. First, for the Ministry of Health, and then for the Ministry of Social Services, Gender Affairs, and Community Development. As it relates to the Ministry of Health, I should remind us all that health is broken down into two components in terms of rendering service to the people of St. Kitts and Nevis. One being in terms of institutional healthcare services, that is our hospital-based setting, as well as the card-in home, and the other being the community-based setting, which represents the 11 health centers on St. Kitts, with the various clinics, the dental units, mental health clinics, and of course the mental health day treatment center. And if I might begin by indicating that for the year 2019, it is proposed that a total of $60,626,283 be allocated to the operation of the Ministry of Health, broken down as follows: $7,418,675 for the capital expenditure, and $53,203,608 for the current expenditure. Mr. Speaker, the Ministry of Health continues to move along a path of recovery and improvement since this Team Unity government would have taken office on February 23rd of 2015. The continued improvements in infrastructure and healthcare services are clearly evident across the length and breadth of the Federation. We can point to major projects such as the renovation and refurbishment of the Mary Child's Hospital in Molyneux, the establishment of an oncology unit at JNF, and the construction of the Mental Health Day Treatment Center at Limekill. And all three of these achievements were accomplished within the first 22 months of this government's life. These improvements were well needed, particularly Mary Child's renovation, given the state of dilapidation that the entire facility was found in, and which would have come to a head in late 2015 when the entire ceiling over the female ward would have imploded. Unfortunately for us, not one patient was in bed at that time. A process of renovation continued thereafter, with the eventual reopening taking place the following August of 2016. The oncology unit, it goes without saying that that is part of the government's response to the NCD crisis facing the people of this country, especially as it relates to the incidence of cancer and the need to treat our people in a quicker manner, in a more supportive manner, and in a more cost-effective manner by putting the availability of chemotherapy right here on the ground so that our people no longer have to fly overseas to get such care. It is expected that over time, the radiation-based therapy will be added. The Mental Health Day Treatment Center, that is a project that dates back, if my memory serves me correctly, as far as 2006, 2007, when I myself, in another life, would have sat on the steering committee of the Basic Needs Trust Fund, and there were constant back and forths as to whether the placement of the Mental Health Day Treatment Center should have been at the grounds of the card-in home, which at the time were already congested. This government took the bull by the horns and pursued the completion of the project. Of course, by the time we would have come out of the ground, we would have lost at least $800,000 of funding through the CDB because of the amount of time that had elapsed before the actual construction would have started. Today, the Mental Health Day Treatment Center provides a dignified response to persons who are recovering from mental illness through a slew of services, including occupational safety, counseling, information and advice on diet and nutrition and consistency with taking medication, and also skill development so that these people can be integrated as soon as possible back into the life of the country. And of course, we do this bearing in mind that a lot of individuals in our country who suffer from mental illness are persons who also suffer from discrimination and whose families at times do not wish to have any association with them. But they are members of our community and they are our fellow citizens. And we remind ourselves that mental illness can happen to anyone at any time. This particular project was valued at well over $1 million by the time it would have been built out and opened. The government would have continued with the reinvestment and recapitalization within the Ministry of Health via public-private partnership. One such is the introduction of the CT scan in 2017. And that CT scan has also assisted us in terms of the treatment and response mechanisms that would have to be in place to address NCDs, especially as it relates to stroke patients, etc. Of course, this is now saving us locally in that we do not have to then burden state resources in terms of finding the extra monies to send persons overseas to get a CT scan, bearing in mind that the one that was already at the hospital had not been operational for quite some time based on a prior partnership arrangement with a Guadeloupe company. We also look to the other introduction in terms of responsiveness to NCDs coming from the private sector, which is being done with the support of government from the standpoint that we do have a very strong relationship with them in terms of diagnostics. And that has to be the introduction of the MRI service at Borio. From the time that project opened in August of 2016 to November of 2018, some 1,354 procedures have been done. And for this year alone, there have been 585 such. So it has made a great difference in the lives of people who would need diagnostics from which medical professionals can then make decisions about their care and treatment. The ministry's latest infrastructure project from the community standpoint is the reconstruction of a brand new health center in the Tabernacle area to serve the people from Bellevue to Atlas. And it is intended that when completed, this modern facility would have replaced the situation that had existed for a number of years, wherein the old health center would have outgrown its size, become dilapidated, overrun by termite infestation, especially subterranean termites, suffered an implosion of the septic system, and the termite infestation had gotten so bad to the point where all of the vegetation, mature fruit trees, all had to be removed because of the termite tracks that were on the trunks of the trees and threatening nearby vegetation in private property. This project would have started in September of 2017, valued at $2.4 million, and is being generously funded by the Republic of China, for which this government is indeed grateful. There's still a lot of ground to cover, Mr. Speaker, as it relates to improvements in the Ministry of Health, but a number of these improvements are not confined or unique to the Ministry of Health. They spread around the length and breadth of the public sector. Some of these are inherited human resource challenges with which we have to deal. And of course, as it relates to the fact that we are obligated to render the best quality care to the people of this country, the Ministry of Health is continuing to pay attention to the quality of service being provided by our people who get paid their salaries from the tax dollars of the people of this country. In an effort to address the wider public sector reform program of which the Ministry of Health is a part, as a result of that, the ministry continues its engagement with a PAHO-funded Human Resource for Health program, which is intended to bring to faster fruition a performance-based transformation that should take place in the federal ministries of health. And of course, this particular project goes above and beyond just an honest situation analysis, where it's actually expected to derive results based on a number of deliverables. Some of them are as follows: ensuring that the required skill sets exist to undertake certain jobs in health, so that our nurses, doctors, technicians in health who can be employed in specialist areas and thereby reduce the national reliance on foreign recruitment can take place, because we do have quite a number of those instances where we still have to recruit specialist assistants from overseas, particularly our nurses. At the moment, we have some 24 foreign nurses who are assigned to the Ministry of Health, operating in specialist areas such as hemodialysis, maternity ward, neonatal, the psychiatric ward, oncology, etc., and the operating theatre. I wish to go on record to indicate that the government is indeed grateful for the support that we have gotten from these friendly governments and also from the Philippines, from whom we do quite a bit of this recruitment, because were it not for that recruitment, we would not be able to offer the types of services that we would require in terms of areas such as oncology, ophthalmology, vascular surgery, nephrology, etc. So we do admonish our people, our human resource base, to take up the opportunities when they exist and to also use their initiative to get themselves qualified in specialized areas so that we can reduce our reliance on foreign labor. Other areas of focus for the Human Resource for Health program include matters such as work ethics, education and training, some of which I just mentioned earlier, manpower allocation to ensure that the right people are in the right jobs, remedial HR intervention for those staff members who may prove to be problematic, moving towards a performance appraisal system that works in tandem with the payment one would receive, and of course other issues include succession planning and strengthening of our middle management and supervisory level within health, and also by extension the rest of the civil service. At this point, Mr. Speaker, I would wish to stress one point here as I broach this subject, and it has to do with the fact that based on our assessment, particularly in the Ministry of Health, we would have noticed a situation where the middle management or supervisory level staff, and also, as I said, in the wider public sector for that matter, it seems as if when promotions are considered, some persons tell themselves that they should operate on a buddy system. So yes, you moved out from the pool of your colleagues and you've now been selected for a promotion with more responsibility, but you're afraid to take the bull by the horns and take leadership with what it comes, the tough and the easy challenges. And what you're finding is that some individuals would wish to maintain a buddy system with their friends. So the support system that the government requires in terms of raising productivity and actually looking at output and performance commensurate with where we should be as a developing nation, some of that is not happening. And we need to insist that our people get to that point. Same thing happens when persons are up, some of them for payment of increments when the anniversary date comes around. You find that because they do not meet the stipulated time frame by which to indicate to an individual that based on your performance you cannot get an increment, there's a reticence and there's a reluctance in terms of doing that. So you find that these things go through the system and people have no benchmarks and targets to follow because it's all a little body system that seems to take place there. Thankfully, that cannot be said for all public sector workers because quite the majority of them are people who are hardworking and who render a fair day's pay, for fair day's work for a fair day's pay. Of course, these persons who do their work well also end up becoming frustrated because regardless of their own efforts at improving productivity and output, they could often be discouraged by the fact that some other members among their colleagues and work teams can be allowed to do, as they say in the local parlance, do as they like. So these are issues that we have to work on. Other issues we have to work on include politically motivated attitudes towards employment. And I have to be very blunt with this, Mr. Speaker, because we have two sets of people in this regard who operate in the public sector, some of them. Those who tell themselves, my party is not in power, so I'm not going to work. And those who tell themselves, my party is in power and I could do as I like. Either way is wrong. And I wish to repeat that either way is wrong. Nobody benefits from that. On the issue of crime, our crime data for 2018 shows that crime overall is trending downward, and we are seeing the evidence of that in terms of the presentation of patients who are victims of crime at our institutional-based services. However, even though we have witnessed an overall reduction in crime in the Federation in 2018, there is still a lot that needs to be done to turn the tide so that we can have a better, more peaceful environment where people have the chance to live and work in the country that is theirs without fear of their lives, fear of their livelihoods, etc. We are grateful for the presence of the RSS here in St. Kitts and Nevis because we can see a direct correlation to that crime reduction based on when they got here. But for example, as I stressed earlier, we are still heavily impacted by crime as it relates to our emergency medical services. For example, in 2018, right up until November, at Jane France Hospital, there were some 29 cases of gunshot wounds, with 10 of them needing surgery and 23 of them requiring hospitalization. We have also recorded some 34 cases of stabbing during the same period, 9 of them requiring emergency surgery and 27 of them requiring hospitalization. Over the identical period in 2018, there were also recorded at JNF some 12 cases of sexual assault, and I will get into that a little further when I discuss social services because there is a dichotomy that exists in terms of that statistic. What we are seeing from these 3 sets of figures is that yes, there's a reduction in crime, because when we look at the comparison over the year before, we are recognizing there's a 3.3% reduction in gun-related injuries over last year, a 22.7% reduction in stab wounds, and a 33% reduction in terms of sexual assault cases over the same period in 2018. Most of the victims of the gunshot wounds are our young men, some of them attracted to a life of crime, gang membership, etc. And of course, there's much more that has to be done for them to prevent that type of antisocial behavior and to create diversion programs to capture them before they become totally captured and indoctrinated by these groups that add no value to community life. However, that being said, the stress on our emergency medical services is burgeoning over and over again. Very often, our emergency teams at A&E and the surgical theater would have ended the day, only to come back in the evening to be told that you have to deal with a gunshot wound injury in an awkward position and it's a matter of life or death. And then, when that is done, the surgical theater door still becomes a revolving door for those individuals because as soon as you patch them up, they come right back again. Just last week, we had the arrogance of one such victim who had to have a dramatic repair of his aorta done. And after several hours of standing in the same spot, trying to save this young man's life, which did happen, Dr. Wilkinson had to suffer the disrespect the following morning of visiting the young man's bedside only to get a slew of bad words thrown on him as to why he's over his bed. Okay? So if professionals were not professionals, they will not be motivated to assist persons. And these are some of the things that we have to look at in terms of the callousness behind crime, because that was really, really unacceptable, considering the investment of time, energy, and skill set that went into saving this guy's life. The Ministry of Health, as I noted earlier, continues to benefit from the public partnership, private partnership approach, as I noted earlier. Much of this is intended to help us realize the goals, the 17 goals as set out by the United Nations for Sustainable Development. And of course, as we do this, we recognize that we do have challenges as a small island developing state. I would have mentioned earlier partnerships such as the CT scan, which has enabled us to move forward in terms of what we wish to do to turn around the statistic and our national incidence of NCDs, for example. I wish to take time out now on that score to basically single out the Republic of China for the support that they continue to give to the Ministry of Health. Yes, I mentioned earlier the $2.4 million investment in the Tabernacle Health Center, but just as we were closing out the month of November, we would have benefited from the addition of 3 Gambro hemodialysis machines to add to the other 4 that we would have already had. The initial 3-and-a-piece machines that we would have inherited when we took office are all non-functional. They have already exhausted their useful life. We now have 7 such machines, and the last 3 additions complements the chronic kidney disease program that Taiwan has been engaged with the Ministry of Health for the last 2 years. And this is a community health center-based program, since we recognized many years ago that we have to tackle NCDs from the primary health care level. Of course, this helps us dramatically in terms of the addition to hemodialysis, because it then means that we have improved by more than 100% the capacity of that unit to treat with persons requiring hemodialysis. If it was not for that, we would have soon been approaching a situation where that unit would have to be open 24 hours a day, 7 days a week, when we consider that we have a growing number of patients, and each round of hemo is at least 4 hours, as opposed to peritoneal, which is an overnight procedure. As I mentioned earlier, the PPP model has shown to assist us in other areas, for example, in terms of the second cruise spear. And it is in line with that too, in terms of the ability to facilitate larger ships and to bolster our tourism product, that the Ministry of Health must work in partnership with the Ministry of Tourism in terms of bringing higher-end medical services to bear, especially when such are presented, especially among the seafaring public, those persons who come here on cruise vessels. Mr. Speaker, what we noticed too is that quite a number of the cruise passengers who come to St. Kitts and Nevis are more often than not the ones who are populating the ICU at JNF. Most of them are persons who are baby boomers, or perhaps as old as in maybe 60s, 70s, and they probably had a bucket list of things they wish to accomplish, including being able to see the Caribbean before they die. And very often these persons are not in the best of health. And invariably, when there are medical emergencies from that group, they are in the NCD category and require attention at the ICU for JNF. So we have to do everything in our power to make sure we keep step with the requirements of development in St. Kitts and Nevis. It should be noted also that a game changer in 2019 when it comes to healthcare would be the introduction of universal health insurance, which the Honorable Member for number 8 will certainly tackle when he comes to give his own support to the 2019 budget. But it is something that we look forward to in the Ministry of Health, as it would mean that more persons would have access to healthcare without having to take into consideration their socioeconomic status. It also would then mean for the other side of the ministry in terms of social services that there might be savings to be had that could be directed to that insurance coverage in terms of the number of emergency medical requests for assistance for persons who would have to not be in a position to be able to afford their health care, whether it is obtained locally or foreign. Ongoing challenges in our health sector, I hinted at some of them earlier. They include the high levels of NCDs, which is a troubling level. Mr. Speaker, NCDs have transcended health and have now become a socioeconomic issue that affects everybody. As it is right now, NCDs would be responsible for 83% of the deaths in the Federation, making up the cadre of infections and illnesses, including cancer, diabetes, heart disease, kidney disease, respiratory disorders, etc. And of course, the United Nations has now included mental illness as part of the repertoire of illnesses and disabilities that constitute the NCD track. We need to do a lot of work in terms of looking at this issue, because by extension it means that our national productivity levels are also in jeopardy in terms of time spent away from work, either absenteeism because of illness, and I would expect the Honorable Minister of Labor is going to touch on some of that when he comes to speak as well, and also those persons who are not necessarily NCD patients but are forced to stay at home caring for persons who are chronically ill with NCDs. So these are matters that we have to look at. We have to also at the same time look at the continuing absenteeism rates, especially among our EMTs, the A&E department, and sometimes the front desk, as well as our orderlies, because that too creates a high impact. The relatively high levels of sick leave is also another issue. And of course, these are matters that we would have to treat with when it comes to the level of the Public Service Commission if they continue at the chronic rates that they are moving at. Undue stress on workers with good work ethics, I mentioned that earlier, short staffing in certain areas, thereby forcing the need for foreign recruitment. And of course, one of our challenges is the need to do the final build out in terms of our IT infrastructure with the interlinkages between institution and community-based healthcare so that we can be ensured that the persons who are requiring health services in the public health system, be it institution-based or community-based, will be able to get care at a faster rate once all of their data is available at the swipe of a card, so that it's easier to know their history, especially if they might have been incapacitated and can't speak for themselves. As a result of the NCD issues, we are facing a higher strain now in terms of the need for pharmaceutical and medical supply procurement to respond to the NCD issues. There's also the issue of HIV and the sustained high rate that we are experiencing. For example, up to December 10th, there would have been 13 new cases of HIV in the Federation from January, 10 males and 3 females. Of these cases, 46% are our young men between the ages of 20 and 29, representing 6 cases. And over the past 3 years, this means that on average we have been clocking some 14 new cases of HIV per year. Currently in the Federation, we have 295 persons living with HIV and 4 HIV-related deaths for 2018 already. I should also note that of the 295 persons who are living with HIV, only 82 of them have chosen to receive antiretroviral therapy or ART. It is not something we can force on persons, even though we wish they would take advantage of it because it is free. That has been made, a certain provision has been made for that years ago. However, of those 82 persons of the 295 who are on the ART, 12% of them, or 35 persons, have experienced viral load suppression. In other words, the level of replication of the virus in their system has gone down to indistinguishable levels. And of course, it is something that we need to work on if we intend to meet the UN targets as it relates to ending AIDS by 2020, the spread of HIV by 2020. To date, in 2018, some 3,747 HIV tests have been done, 3,387 in St. Kitts and 360 on Nevis. There's much greater outreach and advocacy we need to do to encourage people to get tested. And it is for that reason why the UN would have chosen for World AIDS Day on December 1st the theme, Know Your Status, so that our people can put aside their fears, their intimidation, and come forward and have the peace of mind in knowing what your status is. And knowing for sure as well that your matter will be treated with confidence and that the support systems are available nationally should the test result be positive so that you can be immediately linked to care and treatment and other preventive services going forward. For us to achieve the 1990 targets for the benefit of the public, I should indicate that UNAIDS is expecting that 90% of all HIV positive persons would have been tested for the disease and they would have known their status. 90% of them would have been on the antiretroviral therapy, and 90% of those on the therapy should be experiencing suppression of their viral load. We do have 17 rapid testing sites in the Federation, thereby making it easier for persons to get access to testing. These sites include the 11 health centers on St. Kitts, the National AIDS Secretariat within the Ministry of Health, Jane France Hospital, Alexandria Hospital, and 2 designated doctors' offices. So there is a whole avenue that is open to all of us in terms of the choice when it comes to testing. So I would admonish us as a nation to do what we can to find out our status. and be better able to manage our own health going forward so that the quality of life will be sustained for as long as possible. For the benefit of the public, still on the matter of HIV, I wish to note that from 1984, when we began documenting cases of HIV, up to September of 2018, the nation would have recorded a total of 424 persons who were HIV positive, and of course, of this number, 130 persons have already died. So there's still much work to be done and much ground to be covered. Some of the responses to the challenges that we are looking at, Mr. Speaker, include the completion of the project as it relates to job descriptions and performance appraisal systems, as it relates to the move towards a merit-based system within the Ministry of Health. We obviously will have to continue the recruitment of foreign medical and nursing personnel going forward until we can build up capacity locally among our own people. As I indicated earlier, we have some 24 such foreign nurses employed here. We also have to continue the enhancement of our supervisory capacity for frontline staff as well as middle management via training, public education on safe sex practices, as I noted earlier, so that we can reduce the rates of infection for sexually transmitted diseases as well as HIV. And I should also add here that out of the realization by the Ministry of Health of the levels of stress that some of our emergency care workers are under, the Ministry of Health has introduced a staff members health clinic in 2018, where we are making it institutionalized then, so that our healthcare staff will get their own on-the-job healthcare access Monday to Friday, 8 to 4, at the outpatient department of JNF and in Nevis at the similar department for Alexandra. These workers are presenting with higher than normal rates of chronic disease, and of course that affects their productivity and attendance at work. Because it's a hospital setting especially, they work in an unhealthy atmosphere because it's a place where sick people are being treated. We see some of these workers at the accident and emergency department as patients themselves on a very frequent basis. And of course, the research is showing us that the health and wellness programs such as these will also improve the productivity and output of our people over the medium to long term. The clinic, of course, will look at health and safety at work, greater self-esteem, improved health and quality of life, and improved job satisfaction. And the output in terms of the Ministry of Health, in particular the JNF management team, would be a structured, more well-managed program for all staff, as well as reduction in staff turnover and reduction in the associated absenteeism. I would like to point, Mr. Speaker, to some of the good news that we can look forward to based on some of the good news that has already started before year end. And I am happy to report that in 2018, as we speak, there has only been one case, one confirmed case of vector-borne diseases in the Federation, which means that our vector control program is gaining traction. And this one case was a case of dengue in August of this year, found in a 44-year-old male. Of course, we have had no evidence in our system of the presence of Zika. To be precise, the WHO has only just confirmed St. Kitts and Nevis of being Zika-free, since we would have last recorded a Zika case back in 2016, December. Neither do we have cases of chikungunya or leptospirosis. So this is a trend we would like to see continue, and we crave the public's indulgence in terms of the fogging that is going on around the Federation, that you follow their instructions and help us to control the spread of mosquitoes, and do whatever you can in terms of making sure that you are not unintentionally creating breeding grounds for vectors, be they mosquitoes or rodents, because of unsafe or unsanitary conditions around your home. We are still celebrating, Mr. Speaker, the one-year anniversary after the St. Kitts Nevis designation as being successful in eliminating mother-to-child transmission of HIV and syphilis. We are working assiduously to continue on that trend to maintain our status, and at the same time working towards EMTCT Plus, which is taking the evaluation a step further with the elimination of hepatitis B and Chagas disease. So these are some of the areas that we look at as good news. Also, I am happy to report that in July of 2018, the ministry began a pilot program by the introduction of a district medical officer's clinic in Connery, housed within the community center, that was designed to respond to the needs of residents between Keys and Kitstodats. Because of where Connery is located, it's a very awkward place in terms of access based on distance to Newtown Health Center or to the St. Peter's Health Center. So we are using this test to see what the public response would be like before a decision is made to construct a separate health center for that community. I'm happy to report, though, that based on the data I have from Dr. Maria Warner, the specialist who runs that center on a part-time basis, several days a week, half-day sessions, she has recorded that between the opening and within the last week, she would have seen and treated over 270 patients. So it tells us that there was definitely a need for that service. So it looks very much like once the rest of the pilot is built out, we will be looking towards the construction of a new health center in that area. With your leave, Mr. Speaker, I wish to now turn to some of the health indicators and vital stats for St. Kitts and Nevis as the Minister of Health, covering the period January to October 2018. Our present population stands at 48,857, with 12,709 on Nevis and 36,148 on St. Kitts. Life expectancy is still pegged at 68.8 years for males and 72 years for women, with the average being 71. And of course, when we compare that to 1950, the life expectancy was pegged at 50. So it shows us that the quality of life and our human development have gotten to the point where longevity is now being realized, with greater access to health care and policing of one's health, etc. Total births over the period, 473. Total live births, 469, with 91 of them being on Nevis. And of course, of that 91, 89 were live births. In St. Kitts, there were 382 births, of which 360 were live. And of course, these figures indicate that there is a 27.5% drop in the birth rate over 2017. There were 5 cases of multiple births in the Federation so far for the year, which were 5 sets of twins, 2 on Nevis and 3 on St. Kitts. Registered deaths for 2018, there has been a total of 327, with 81 of them being recorded in Nevis. So, Minister of Labor, we have to do some work with your replacement rate in Nevis, because if we are having 91 births and 81 deaths, we are not basically replacing ourselves in Nevis. Yeah, you do some transfers, okay. Right. So we need to work on that. Most of the deaths, 54.6%, have occurred in the age range 50 to 94. And of course, the highest number of deaths in Nevis was recorded in St. Paul's, which is not surprising because it is the most densely populated parish in Nevis. On St. Kitts, the highest number, 177, was recorded in St. George's. Again, St. George's in St. Kitts is the most densely populated parish. So those are not surprising statistics. In terms of deaths among juveniles, there have been no deaths of children between ages 1 to 4 up to October. However, there were 13 infant deaths in the under 5 age group. Let me repeat that so it does not come across as if I'm contradicting myself. It simply means that for the age group above 4, but not yet 5, we have had 13 of those deaths. But this is the way the UN records that data, so I had for clarity to explain it again. There were 9 neonatal deaths occurring up to 4 weeks after birth, 9 perinatal deaths, and these are stillbirths and deaths within 7 days. There were also 2 maternal deaths up to November 30th, And of course, there was a remarkable improvement in babies born with low birth weight. In 2017, there were 55 such births. And of course, this number has dropped dramatically to 10 in 2018. So that is some good news as well. And of course, this reduction represents an 82% improvement over 2017. And the ministry commends the work of our national medical and nursing staff at our public antenatal clinics, as well as the private OBGYN offices, in terms, and also in expectant mothers in making sure that they have healthier pregnancies. The teen pregnancy rate for St. Kitts and Nevis, and these are girls between the ages of 12 and 19 for purposes of the UN, even though I did say teen. Nevis recorded 10 such births in 2018. St. Kitts recorded 37. This means that the total teenage pregnancies between January to October of 2018 was 47. And it represents a 30% reduction in the teen pregnancy rate over that of 2017, when we would have seen some 67 teenage pregnancies and related births. And of course, all of these births then tell us that the reduction in the birth rate tells us that more and more of our teenage women are taking their education more seriously and are delaying the onset of motherhood so that they can complete their education in an uninterrupted fashion. The maternity ward of JNF would have recorded that out of 463 admissions, some 32 of them were for teen mothers. And of course, this represents a reduction by 22% when you compare it to the admissions in maternity ward for teen mothers in 2017. So again, it is a very good sign for us to have that reduction. If I may move on to the issue of NCDs as it relates to the Federation and the challenges we continue to confront. In St. Kitts, and I'll start with cancer cases, St. Kitts recorded 52 cases, of which 28 are female, and the leading cancer in St. Kitts remains breast cancer, which accounted for 8 of the cases. There were 29 cases of cancer in 2017 in Nevis last year. Regrettably, up until today, I did not have the data for Nevis. However, I do know that based on the unofficial data, the trend is that in Nevis, prostate cancer represents the leading type of cancer on that island. So we do have to do some work on that. So it appears that the leading cause in St. Kitts is breast cancer, and in Nevis it is prostate cancer. There were other smaller representation of cancers, including cancer of the tongue, the adrenal glands, rectosigmoid colon, the gluteal mass, and so forth. But these were just one-off cases that were not necessarily the norm. However, as I mentioned earlier relative to Nevis, if I could just put that leading cause of cancer in context from the unofficial data, 95% of the Federation's cancer cases are coming from Nevis in terms of prostate cancer. Hypertension, our 17 health centers would have recorded a total of 1,848 persons registered at their clinics. And of course, a total of 80.6% of those registered are persons over the age of 60. By extension, diabetes would have had a registration among our 17 health centers of 1,737 who would have attended the clinics. And of course, a total of 72.1 of these diabetics are persons are persons who are age 60 or over. I repeat, a total of 72.1% of the diabetics registered at the 17 health centers are over age 60. It should be noted that for diabetes and hypertensive clinics combined, we are seeing that females represent over 73% of the patient count. And this falls in line with the official address that would have been given earlier this year when Diabetes Awareness Week would have been celebrated, corroborating the statistic now all over again. The full diabetic count, we do not have access to that information. I can only provide information as it relates to persons who register at our health centers. We do recognize that a number of persons, especially those who prefer to have their privacy or who could afford private health care, would be seeing their private physician, and therefore we may not necessarily have access to the data for diabetes and hypertension for those groups. Amputations associated with diabetes in 2018 amounted to 31 thus far, compared to 23 over the same period in 2017, and most of these were for removal of digits, toes and fingers, and lower limbs below the knee. In terms of the hypertensive cases, in terms of St. Kitts and Nevis, we are also seeing that in St. Kitts, the highest representation of these individuals are occurring in the St. Paul's, Bastia, St. Peter's, and Sandy Point health centers. And for Nevis, the highest concentration we are seeing happening in Brownhill and Charlestown at those two health centers. And of course, those health centers normally are a direct reflection. The registration is a reflection of the population too of those parishes. Kidney disease, the statistics are showing us that there were 27 patients up to September 30th who were on hemodialysis, who were kidney patients rather, and of that number, 22 were for hemodialysis, and there were 5 peritoneal patients that we would have dealt with, and of course, those cases were mostly of our people in St. Kitts. 63% of the hemo patients are male, 31% are under the age of 50, and the youngest patient we have in the Federation on hemo is a 14-year-old girl. Of course, we do have that there are 55%, there's a 55% representation of persons who are both hypertensive and diabetic that constitute the population of the kidney patients being served by the hemodialysis or peritoneal service. And separately, 33% of them are hypertensive. We go on, with your leave, Mr. Speaker, to look at the eye clinic. The Jane France Hospital Eye Clinic continues to be a success story. For the year thus far, there have been 3,318 cases that would have been seen by the unit, and this is an 18% reduction over last year's figure. Some 60% of these patients were female. 16% suffered from hypertension, while 6.6% of them suffered from diabetes. Glaucoma cases have increased by 64.8% since the year 2014. So that is a trend that is going up. And there was also an increased incidence of cataracts and diabetic retinopathy. And the highest patient flow we have seen would have been, as I said, those with glaucoma, totaling 1,034 or 31%. And the second highest patient flows were among persons presenting with cataracts and pterygium. The eye clinic also reported a dramatic reduction in the number of cases of conjunctivitis or red eye for 2018 for the first 9 months, with 59 cases. And of course, this compares favorably over the same period of 2017, where there were 327 cases of red eye, representing an 81.9% reduction over the figure for last year. The oncology unit, where we treat our cancer patients with chemotherapy-based responses, we have recognized that as you go through your budget, that there's a dramatic increase in allocation for pharmaceuticals, as I mentioned earlier, and medical supplies. I think both of those heads had an average increase of some $500,000, and that is largely as a result of meeting the need based on the demand for the increase in patient size, the increase in the amount of business that center is doing, as well as the hemodialysis unit, because we have more patients. So it is costing us a pretty penny as we continue to deal with the issue of NCDs. The hemodialysis unit would have had in 2018 96 patients on treatment. There would have been 51 new cases diagnosed in 2018, and some 38 of these persons would have reported to the unit between January and September and would have been placed on treatment. 72% of those patients, or 69 in number, were female patients. 46% of the total patient load were persons over the age of 60. 32% of them were presenting for treatment, unfortunately, when they already were in stage 3 or stage 4 cancer. We would much prefer if we can have access and screening earlier than that so that the outcomes can be greater improved. 82% of these patients at the oncology unit are patients who are based in St. Kitts. And the most frequent cancers we would have diagnosed in 2018 would have been colon cancer, 12 cases, which means 23.5%, breast cancer, 8 cases, which is 15.6%, and skin cancer, 7, or 13.7%. And in the year 2018, unfortunately, we would have recorded some 5 cancer-related deaths based on the patient load at JNF. Mental health statistics, there were 73 clinic sessions that were held with 714 patients in attendance thus far for the year. And of course, the highest patient traffic is in the Bastille area with 416. And then the second highest is Her Majesty's Prison, which would have recorded 149 cases of mentally ill patient contacts over the 17 clinic sessions that would have taken place for the year. There has been a total of 391 males at these clinics and 321 females. And of course, we have also seen a trend where it's the males who are most likely to do follow-up visits for mental health rather than the women. I don't know why, but that is what we are noting at the moment. We are also recognizing that a total of 34 new patients would have been recorded in 2018, and the top diagnosis at these mental health clinics were for schizophrenia-related conditions. And of the number of patients that would have been seen, that represents some 323 persons. The Mental Health Treatment Center, which opened fully to the public in September 2017, would have seen a maximum of about 17 patients who, as I indicated earlier, would have benefited and continue to benefit from occupational therapy, counseling, sanitation, and personal hygiene needs, medication, physicals, etc. Some 65% of these patients at the Mental Health Treatment Center are males, 23% are under the age of 25, and we are seeing a trend where marijuana is being listed as the most frequent drug that is used by the patients. And as I indicated earlier, quite a number of them are reporting with schizophrenia-like tendencies, and 2 of those cases would have indicated that their illness would have been exacerbated by cocaine use. Earlier in 2018, we would have changed the name of the center in honor of the late Arthur Lake, a local psychiatrist who would have done much of the groundwork in terms of responsiveness to mental health issues in the Federation. At our dental health clinics.
Sorry to interrupt. Just need a clarification. You mentioned the number 713.
714. In terms of the mental health patients.
What does that represent? What is that number?
Okay, it means that throughout the course of the year, there would have been 73 clinics held. Clinics are normally held at the community-based health centers. And during that time, there would have been 714 patient contacts that would have taken place.
Meaning 714 patients, different.
Yeah.
Okay. Understood.
And of that number, 323 of them would have had diagnosis bordering on schizophrenia-related type manifestations. And as a result of, based on what some of them are saying, marijuana use, and to a lesser extent, cocaine use. Okay, the dental health clinics now. There were 4,008 examinations done so far in 2018. 1,277 were children and 3,105 were adults up to the end of September. This is a reduction by 41 over the same period last year. And of course, some of this may have been due in part to the fact, Mr. Speaker, that the Ministry of Health was forced to close the Newtown Dental Clinic for some extensive repairs because of widespread termite infestation. And of course, because up until the end of July of 2018, there would have been no operational dental clinic at Mary Charles. All of the patients would have had to resort to the Pogson Medical Center for dental work. So there was a significant load on that center. So to a certain extent, maybe some of the fall off is in relation to that because of the distances one would have to consider to travel. However, I'm happy to report that the Newtown Dental Clinic is due for reopening, Minister, for number one, before the end of the year. And I wish to thank the Public Works Department, over which you have leadership, for getting us to that point quicker than we expected. Okay? The presentation of the examinations are broken down as follows. Dental extractions, there would have been, of that, 12 of them. Permanent fillings, 52. Temporary fillings, 44. And of course, there was an increase in dental prophylaxis, 188. Filling and cleaning, 106. Medication being prescribed, 97. The ministry is happy, as I noted earlier, to record that the dental unit at Mary Charles, which had been closed for a number of years predating the start of this government, would have been reopened and completely refurbished by the end of July of 2018. So it would have taken some of the burden away from Parks Medical Center, especially as I indicated that the Newtown Dental Clinic had to be closed because of the termite issue. So we are grateful that that has now reopened. In terms of the 2019 projects, with your leave, Mr. Speaker, I would like to point out that there will be a continuation of the health information system build-out, which has been graciously funded by the Republic of China in terms of getting access to care at a faster rate for our patients who present at both our institution and community-based health infrastructure and services. Completion by extension of the interconnectivity between these centers, the health centers, hospitals, and of course the reconstruction of the Tabernacle Health Center we are hoping to complete by the end of the first quarter of 2017. There is continued restructuring in terms of the health information unit as a part of our determined response to the NCD crisis that we are facing, and also by extension to the need to change attitudes and behaviors towards testing as it relates to HIV. The National Strategic Plan for Health will therefore be further built out. This is clearly outlined in the estimates book, so I will not get into that. I would now like, with your leave, Mr. Speaker, to turn to the HR provisions in the estimate for 2019 on the health. There are a total of 15 new positions that are being requested, broken down as follows. 6 new medical officers to augment the staff at our hospitals. And of course, these officers are being selected following a period of internship, where the hospital management would have selected the best out of the cohort for employment. Primarily, they will be assigned to the A&E as well as outpatient departments. 1 post of a student pharmacist, 1 additional post for a psychiatric nurse. At present, we only have about 3 or 4 certified psychiatric nurses in the entire federation. So this is something that we need to work on, especially now that we have the addition of the Mental Health Retreatment Center. There's also a request being made of a cardiologist, and this cardiologist runs in tandem with a major capital project that I would have gotten into later, but I will enter it here. And that has to do with the build out of a brand new cardiac catheterization laboratory that we intend to start in 2019. So the post is for an interventional cardiologist. And of course, again, this is in response to the NCD crisis that we are facing. By extension, and again because of the NCD crisis, and to respond to the needs of stroke patients who suffer from speech impairment after a stroke, there's 1 post for a speech therapist for the first time in St. Kitts, I know that Nevis has already put in place at least one speech therapist that serves the needs on that island. And if my information is correct, that individual sometimes comes over to St. Kitts to render care and therapy to persons over here. One additional post of a senior clerk for the Office of the Permanent Secretary, one executive officer's post for the Office of the Minister, and 2 laboratory technologists who are needed to deal with the increasing demands being placed on the laboratory at the Jane France Hospital in terms of testing diagnostics for NCD-related illnesses. Mr. Speaker, the hospital lab is overrun with phlebotomists. We do not need any more phlebotomists. What we need are persons who can then take those samples, interpret accurately the results, get them back to the medical professionals so that the proper treatment protocols can then be put in place. I would, for the record, state here that I have noticed utterances in the press concerning long lines at the laboratory. Yes, there are long lines, but then that's because of the short staffing issue. We cannot do better than what is happening right now. At present, we also have 1 lab tech who had to be suspended because of subordination issues. That matter is now before the PSC. But for the comfort of the public, I would like to note that the 2 lab techs that are being recruited should be here by the end of the month, being recruited out of Cuba. On that score, I would also like to say to the critics who are complaining about the long lines that the government does not have a monopoly on the establishment of a laboratory as a business. So if there is a need, there's also a niche that can be filled by anyone who so cares to get into that line of work and join the ranks of other private laboratories such as Avalon. There's also 1 post of a dental surgeon that is being requested, and that one is a bit of a no-brainer, because if we have now reopened dental services in Molyneux at Mary Charles, it means that we need more manpower to ensure that that center is properly staffed. The capital projects, by extension, as I mentioned earlier, we are trying our best in terms of the build-out of Phase 3 for the JNF with the support of the Minister for Number 1 and his team in Public Works in terms of the close-off of utility lines at the back of that facility. We cannot put a wrecking ball in that old dilapidated structure until all of the lines for electricals, water, etc. have been rerouted, because for whatever reason, when the new hospital was built, the service was fed from the old section of the hospital. So that is something we are looking at. The cardiac catheterization lab I mentioned earlier, that will be started in 2019 with an initial allocation of 1.9 million out of a full allocation, if my memory is correct, based on the first volume of the estimates, is over $5 million, thereby complementing the other services already available on island, such as CT scan and MRI. And of course, Minister of Tourism, this means good news for you too, because since we are seeing an increased tendency among cruise ship passengers representing with these types of NCDs, it means that the level of responsiveness for cardiac issues can be improved by Jane France Hospital. Regrettably, up to yesterday or the day before, we would have recorded a death for a cruise ship passenger based on a heart attack from the Norwegian Jade. And before the night was over, there was also a near death of a 59-year-old female who had a massive stroke but subsequently was flown out by yesterday morning. So these are part and parcel of our responsiveness to the development that we would wish to see in St. Kitts and Nevis while tackling our existing NCD challenges. Okay. The health sector improvement program, that is going to continue apace with renovations where necessary to the 11 health centers. In the case of the St. Peter's area, a brand new health center pegged at 2.5 million is pegged for that area. Member for number 8, I am sure you're happy to hear that. And of course, as I close off my input on health, I would like to note that the Ministry of Health is also current with its quota contributions as it relates to international agencies, PAHO, in the amount of 21,373 US, and all of these figures are US. CARPHO, Caribbean Public Health Agency, 41,772. Caribbean Accreditation of Medical Councils, CAMC, $1,500 US, and the Caribbean Accreditation Authority for Education and Health Professionals, CAMPH, at US $4,966.50. That brings me to the start now, Mr. Speaker, of my budget rationale for the allocation to the Ministry of Social Services, Gender Affairs, and Community Development, for which a 2019 allocation has been listed at $34,370,192. I think that's the figure that I have here. And of course, this represents an increase of 84.3% over 2018. And in the course of my narrative, I will explain the justification for that increase. The ministry continues, together with its sister ministry, Health, to be responsible for most of the social programs for the government, with the exclusion of national security and education. And of course, this means that we have to have an interdependent approach to the management and program delivery of that ministry, with stakeholder groups at the community level, NGO groups, friendly governments, international donor agencies, etc. That ministry is also suffering from the burden by NCDs, because obviously the ministry does have assistance programs for persons who cannot afford their medical treatment, especially related to NCDs. We are also seeing as a ministry the continued sustainability of more of our persons living beyond age 100. Persons may recall in 2017 we had for the first time some 19 centenarians in the country, and of course at that time the oldest living person was in Nevis at 105. If she lives to see the first quarter of next year, she would be 107. And hello? Really? Okay, and that person is Miss Cillian Powell from Nevis. So we are quite heartened by that demonstration of longevity, which sends a message that our people are enjoying an improvement in the quality of life and in their human development overall. So the ministry does have a department, a unit within the department that deals with that outreach to the elderly, to the point where we have chosen not to confine our activities for the elderly to the month of October. We spread it out throughout the whole year. We continue to manage the New Horizon Rehabilitation Center in Harris Village. A total of 11 residents are there at the co-ed facility. 5 of them are females, 6 of them are males, and by weekend there should be 1 extra female being sent there from Nevis by the magistrate, I am told. And of course it's a place of second chances, a place of safety and security for children who are in need of care and protection, and also to address the needs of children who are in conflict with the law. There has been a subsequent build-out of the operational structure of that facility by the UNICEF-sponsored project for the standard operating procedures, training of staff, etc. So that is being built in. I am happy to report that these students are also showing good results at CXC. In 2018, there was a 100% pass mark by the 5 students who took subjects, and that is very encouraging. They took subjects such as mathematics, English, social studies, and EDPM, which is the electronic document preparation and management curriculum. So we are so proud of them as they ready themselves for the world of work, even while they're in a structured institutional setting. The ministry continues to function by extension as the intermediary between the St. Kitts Nevis Association of Persons with Disability and the government. We continue to provide rent-free accommodations to that group at the McKnight Community Center, and also provide a monthly subvention of $2,500 to cover a number of their activities, including the cost of hiring a driver on a monthly basis to operate the special purpose bus with wheelchair facility that the SIDF would have donated. Of course, our child probation and welfare services will continue in the new year. That is still a work in progress. The Child Probation Board is working towards the proper build-out of that unit. I was advised with some good news by the legal department this morning that finally the regulations for the Child Justice Act that was passed in 2013 are finally ready for signing, so that the various subcommittees under the Act can function properly. And for this, I have to thank the Attorney General and his staff, because it's a situation that we inherited in not having the regulations. So it then enables us for the Child Justice Committee to function properly and so forth. In terms of the foster care program, we have some 32 children in foster care, 11 males, 21 females, and of course we also have another 24 children who are in kinship care. What do I mean by that? Kinship care, as opposed to foster care, is when a child is placed with a relative, not necessarily the parent, but it is felt that that is the least disruptive way to maintain some semblance of order, discipline, and boundaries, and lessening the disruptive nature that the child would have away from the parent. So we do have 24 7 males and 17 females in that particular program. In terms of the ministry's provision with food vouchers, for the year 2018, we would have spent almost $718,000 on the food vouchers among 369 households. And of course, there would have been a number of 716 persons in those households who would have benefited from that. By extension, we would have spent some $97,979 on burial support, $624,464 on medicals, and on this score, we expect that in 2019, as the universal healthcare coverage is built out, that we can then reduce the stress on this budget head, member for number 8, and hopefully negotiate to transfer that amount over to that insurance project, since the logic tells us that we should not need to have that type of recourse. Gender Affairs continues to work closely with the Special Victims Unit to address the needs of persons who are victims of domestic violence, etc. That unit continues to manage Project Viola, which is the Teen Mothers Program that allows them to complete their education without it having to be disrupted by the birth of a child, most likely an unplanned pregnancy. Victims of domestic violence in St. Kitts and Nevis, Mr. Speaker, are both males and females. We are seeing that the Federation's data up until November 2018 reflects some 90 cases being reported by female victims, while another 30 are reported by male victims. And if I could get some more into the detail on that. For a total of 120 instances of this domestic violence, we are also seeing that the data and the incidence is trending downward. As I indicated at the start of my presentation for health, I would have indicated that crime on average is trending downward. And the data now from the domestic violence stats is corroborating that. Compared to 2016, there were 137 reported cases by female victims. So this means that there's a drop of 34.3% in terms of that incidence. Inversely, when we compare it against the male victims of domestic violence, however, there is an increase by 50%. Because we are now seeing in 2016 there were 20 male victims, and in 2018 there are 30. We need to remind ourselves that domestic violence is characterized by sexual, verbal, and physical abuse. And of course, even though the victims are predominantly female, in terms of 84 cases, mostly for physical abuse, you see like 66 cases coming up there, you're having men over the age of 30 with the most instances of abuse, and by extension, women over 30 are the predominant victims as well. And there have been 28 male victims, and in that particular case, in terms of them being over the age of 30, and in most cases, these men are reluctant to report these cases of abuse, and I think it has a lot to do with how men are socialized in this country, where you neither want to admit that a woman is beating you up, not to have to go to the police station for fear that somebody may laugh at you. But nevertheless, it does happen. So what we are seeing also is that there's almost a 50%, 50-50 distribution in terms of victims of verbal abuse across gender lines, where there are 51 in terms of the 22 cases, in terms of verbal abuse of women and 21 for men. For 2018, we have only seen 2 cases reported of sexual violence by the police. And this is what I was speaking about earlier against JNF's data of 12 cases of sexual assault. It means then that if the police has only 2 cases of sexual violence reported and JNF has 12 cases, it tells us logically that whereas the victims are willing to seek out emergency treatment at the health facility, they are reluctant to report the crime. And this is something that we have to work on, because it really, the difference between 2 and 12 is a wide chasm. So there must be some accounting for that. We are also hoping that by the launch of the domestic and sexual violence complaints and response protocol, when all of the agencies develop the synergies that are necessary to deal with this travesty, that we will see a reversal in that, and that more people will come forward so that their perpetrators can be brought to justice. I would also note here that in terms of the community centers, they are still being managed fully by the ministry. And of course, we've had some issues of termite infestation, and as a result, some work had to be done on some of them, including Keon, Old Road, and St. Peter's. And of course, in the case of Lodge Community Center, that would be rebuilt, and there is an initial allocation of I think it's 500,000 that has been allocated for 2019 as part of the initial build-out of that new project. The other centers requiring work in 2019 would include Parson Ground and McKnight. And of course, the importance of the build-out and repairs to those centers are due to the fact that they also function as hurricane shelters, and they have to be in top working condition. And also because of the decision taken since last year by government to decentralize social services and put representation of the ministry there to give closer access to the recipients or clients of the ministry. Presence is there now from the social assistance officers, home care officers, child probation staff, etc., and gender staff, so that people can get care in their communities and program development and delivery can be more in line with the actual needs of the community, since you cannot do social work from your desk. You have to go out in the community at the grassroots level and see how people live, then design programs that meet their needs. The counseling unit, I'm happy to report, in Greenlands continues to go from strength to strength. They are now part of the USAID-funded YES program, that is the Youth Empowerment Services, where they're engaged in a Family Matters program to deal with families where there are children with risky behaviors, issues of parenting, leave a lot to be desired. There's a potential for attraction to gang culture and lifestyle. And of course, with this particular project, the unit has had to move out of the Greenlands location and is now moving into a more suitable space in college housing for the life of the project. So there will be more information on in the new year dealing with that. The project is intended in the first instance to last a year. On the matter of BNTF, by now the entire country should know that the BNTF program has come to an end. The ministry has tried its best to absorb the staff that would have been left in the cold. And of course, that is a matter that is being finalized. There might be just 1 or 2 other staff members who are in need of reassignment, perhaps in other parts of the civil service where necessary, where their skills can be used. Of course, when it comes to the home care program, we currently have some 21 officers serving 265 clients in St. Kitts. Some of the special achievements that we have noted in 2018 is Cabinet's approval in March of 2018 to coincide with the International Women's Day. There was the approval of the Domestic and Sexual Violence Complaints and Response Protocol. And of course, subsequently, that project was launched to the public just in November, a few weeks ago. By extension, we are also happy to report that the National Gender Policy has been launched in November. This is a project that has been outstanding since 2014. And it is such that it has now been funded by UNESCO, with former Director of Gender Affairs, Ms. Ingrid Charles Gomes, being the one who is addressing that particular matter. Now, if I may, with your leave, Mr. Speaker, move on to the government's other 2019 projects that will be the most impactful, in our opinion, in the lives of the people of St. Kitts and Nevis, and that has to do with the poverty alleviation program, which the Prime Minister, the mover of the bill yesterday, would have spent some amount of time discussing. It would have been a subject which the leader of the opposition himself would have tackled today. And it is a project which is the delivery of a campaign promise from the government to be vested in the Ministry of Social Services, but obviously in keeping with the Social Protection Bill, which would have had its first reading in March of this year. It calls for an interministerial approach to manage that particular project. So there is representation as well from the Ministry of Finance, the Ministry of Sustainable Development, and also from community-based stakeholder groups, so that the provisions of that act, when it is passed, would be reflected in the work program in and around the whole larger agenda of attaining the sustainable development goals and improvement in the human development of our people. Now, I just wanted, for the record, Mr. Speaker, to correct an issue noted by the leader of the opposition this morning in querying where in the estimates the provision for that particular program should be vested. And I would like to indicate to him, and for the benefit of the public, that the project started in 2018 in July, and an initial allocation on the recurrent expenses would have been made in the amount of $10 million to start the build-out. The mover of the bill would have indicated that the data gathering exercise would have started in July. Assessment and verification of data would have continued in September through November. And if I may, with your leave, Mr. Speaker, point the leader of the opposition to page 22 of volume 1 of the estimates. I will be willing to show him where the rest of the build-out for that project is going to be. If we can turn to page 22 of volume 1 of the estimates, and we come to the item number 08082, which is under a larger public assistance head called, hold on, it's a head called Managed Community Development, and for 2019, the allocation to that project has been pegged roughly at $26.6 million. So that is where that can be found under the recurrent expenses. If I can now proceed, now that I have cleared that up, what I would also like to add is that the poverty alleviation program, in as much that it is a game changer in terms of helping lift people out of poverty, it is also a project that is intended to work with what is already in place. It is a project, when built out, that would see an augmentation of the National Household Registry that already is in place, where all eligible clients will be listed therein and monitored. There's a case management component built into it in terms of job skills, etc., qualification and training where possible, because we do not expect to keep these people on this project for life. We want people to have a better quality of life, a higher standard of living, and by extension, when the time comes for us to have subsequent poverty assessment done by the CDB, we can point to successes and the data from projects like this to show that they added value and they turned around a trend that would have been otherwise an adverse one. The clients who are eligible, as was indicated, are persons who would have to prove that their combined household income would be below $3,000 per month, and that is something that is going to be followed very closely. And of course, it is something that is a work in progress. We recognize that it is unlike anything else that we have ever seen in terms of CARICOM as it relates to social development, but we don't necessarily have to wait for another country to start it before we do it. It's a matter of responding to the needs of our people and getting everybody into a better place so that St. Kitts and Nevis, for them, the advantaged as well as the vulnerable, could have St. Kitts and Nevis as a preferred place, the land of their birth, to live a decent quality of life. The Boys Mentorship Program for the Department of Gender Affairs is going to continue apace in 2019. We have already built out the program in 2 schools, namely Sandy Point, Charles E. Mills High School, and Bastia High School. And with the support of the Minister from number 5, we intend to build out in 2019 to Washington Archibald High School and the Keon High School, using mentors from the community who can help these at-risk young men have other alternatives other than a life of antisocial behavior. And we are already beginning to see the results from that program take shape. Older persons in 2019 will see a return of the Golden Years Club to deal with seniors who want to continue mentoring our younger people and transfer knowledge and skill sets, arts and craft, etc. Of course, we are also going to see the completion of the ratification for the UN Convention on the Rights of Persons with Disabilities that the Cabinet would have approved for ratification since around 2016, and we now need to follow up on that, as well as the National Policy on Aging and Related Action Plan. And there is also a Special Needs Policy and Action Plan for persons who are suffering from disability. It's an EU-funded project for which we eagerly await the report. We do have other reports forthcoming in the new year, and they include the mandatory reports to the UN for the Convention on the Rights of a Child, as well as the CEDAW Convention. And on this score, I would say, Mr. Speaker, that St. Kitts and Nevis, and by extension, this government has inherited a situation of serious delinquency. St. Kitts and Nevis would have acceded to the UN Convention on the Elimination of All Forms of Discrimination Against Women since 1985. We would have had reviews done, the initial first, second, third, and fourth reviews done in 2002. We should be reporting at least every 4 years, but of course we are behind in that the 5th, 6th, 7th, and 8th report, which should have been done, have not taken place yet. So it is a matter that the Department of Gender Affairs is working to correct, because the more delinquent we are, the less likely we are to get the type of funding that we require. It is a matter that we inherited, but we have to fix it for the benefit of our women. The amendments to the Domestic Violence Act, that should be coming in 2019. I should note here that this bill would have received all 3 readings in the prior administration, but regrettably it was never gazetted. So the bill is of no effect. However, the bill is due to have several amendments, and the one blatant loophole that we already see is that persons who commit acts of domestic violence to partners from whom they are estranged get off the hook because the assault did not happen in the house that they share anymore. Now, I don't think that that is acceptable in a modern St. Kitts and Nevis, because if you have to run from a partner because of domestic or other abuse and they still run you over and beat you up and do all manner of harm to you, I don't see how any court of law could say that you have not committed an act of domestic violence just because you no longer live with your attacker. So this is going to be one of the most significant amendments to this piece of legislation that we hope to pass quickly. As I indicated, it had all 3 readings but was never gazetted, but now that we've examined it, it is in need of some looking after. Private security in 2018 had been procured for New Horizon Rehabilitation Center. That will continue in 2019 out of need and requests by the DPP to the tune of $300,000. There are no new staff positions that have been allocated to the ministry for 2019. And of course, the large community center on the capital would have an allocation of $700,000 to begin with. I think I said that earlier. And the renovation works to the community centers valued at $200,000. The ministry continues to render support to various community organizations and international groups, including the rent for Ade's Place at Greenlands for children and young people with special needs. That rent is $13.50 a month. Children's home subvention, $40,000. Free accommodation, as I noted earlier, of persons living with disability at McKnight Community Center, and the monthly subvention of $2,500. And the Ministry of Social Services is also responsible for the annual contribution to the International Migration Office, and to the tune of $1,300 US. Mr. Speaker, I think I have said a mouthful. It has been a lot of data that I would have been obligated to present to the people of this country by nature of the ministries that we are responsible for, so that the people of this country can have an accurate status of the state of play as it relates to healthcare and also in terms of social services. I am grateful for the opportunity to rationalize my support of the Appropriation 2019 Bill of 2018 and wish it safe passage. May it please you, Mr. Speaker.